Hello everyone, welcome back. My name is Dr. Vijay Bhatia and today we are going to talk about dependence syndrome. What is dependence syndrome? This is a cluster of behavioral, cognitive, and physiological phenomena that develops after repeated substance use and that typically includes a strong desire to take the substance, difficulty in controlling its use, persisting in its use despite harmful consequences, a higher priority given to substance use than to other activities and obligations, increased tolerance, and sometimes a physical withdrawal state. It's a big statement, and we are going to discuss each one of these in more detail. But it's important to remember that it is a combination and it is a cluster of behavioral and cognitive, your thinking process, and even physiology, the body's physiology, the need, and dependence may be for a specific psychoactive substance, example like tobacco, alcohol, or diazepam, or for a class of substances like opioid drugs, which will include morphine, methadone, heroin, cannabis, marijuana, and benzo drugs like Valium, lorazepam, Atarax, and other drugs within that class, or for a wider range of pharmacologically different psychoactive substances like magic mushrooms and hallucinogenic drugs, amphetamines, and others. Repeated drug taking present for at least 1 month, and sometimes if it is less than 1 month, then it is repeated again few times within 1 year that will fulfill the criteria for dependence syndrome. In order to fulfill the criteria for dependence, we need to have minimum of 3 or more of the following manifestations. They should have occurred together for at least 1 month, and if persisting for periods of less than 1 month, should have occurred together repeatedly within a 12-month period. So there are 6 criteria and we will be focusing on them. So number 1 criteria is a strong desire or a strong sense of compulsion to take the substance. You are driven, you are pulled, you cannot do without it. There is a compulsion, as if you are not in your own control. You have to go and get it. That is the meaning of compulsion, that it is beyond your control in a way, that you feel that you have to go and get it for whatever reason. There is a strong desire and sense of compulsion to get the same substance. If the person is drinking alcohol, they will cross the limits to go and get the drink if they haven't had for some time, and they feel a strong sense to get it. Number 2 criteria. There is impaired capacity to control substance taking behavior in terms of its onset, termination, or level of use, as evidenced by the substance being often taken in large amounts or over a longer period than intended, or by a persistent desire or unsuccessful efforts to reduce or control substance use. So what happens here is there is impaired capacity to control the substance taking behavior. What happens in the even to initiate a drink, you have a small drink, then you have difficulty stopping it. Then once you start drinking, there is difficult to stop drinking, or you know that you are getting drunk and you shouldn't be using more, but you keep on doing that. There is impaired capacity to control substance taking behavior. And this is evidenced by the substance being often taken in large amounts. So you end up getting intoxicated using large amounts, or for a longer period than intended, or by a persistent desire or unsuccessful efforts to reduce or control the substance use. So even if you want to stop the substance, there is failure, unsuccessful efforts. It doesn't help. So that is the criteria 2. Number 3, there's a physiological withdrawal state when substance is reduced or seized, as evidenced by the characteristic withdrawal syndrome for the substance, or by use of the same or closely related substance with the intention of reliving or avoiding withdrawal symptoms. So what happens is, when it says the physiological, that means it is the need for the body. Like the body wants the food, the body wants to maintain the blood sugar, and the same term, the body wants to maintain the alcohol level or other things. And why do we need that? Otherwise we will get the withdrawal symptoms, and withdrawal symptoms can be very distressing. They can be emotional and physical and psychological, and they can be like dehydration, sweating, vomiting, muscles twitching. So depending on the substance, there will be withdrawal state, especially when the substance is reduced or seized. And these are evidenced by the characteristic withdrawal syndrome for that substance. For alcohol, they are very typical, and for all the other substances, like for opioids, it will be like cold turkey. So what happens is, you want to use something, either same substance or very much similar to that substance, in order to stop those withdrawal symptoms. Otherwise the person gets quite anxious, worried, and these symptoms are not nice. They make you feel very uncomfortable. Number 4 criteria. Remember, we have to have minimum of 3 or more in a period of at least 1 month, and if it is less than 1 month, there should be more repeated episodes within a year. So evidence of tolerance to the effects. The word is tolerance. What does it mean? Such that there is a need for significantly increased amounts of the substance to achieve intoxication or the desired effect. So in the beginning, I was using a small amount and getting the same effect. But now I have to increasingly keep on using larger amounts to get the same effect that I used to get with a small amount. And to get the intoxication, it will be even larger amounts you need, or a markedly diminished effect with the continued use. And if I don't keep on increasing the amount that I take, then the effect I used to get, the buzz I used to get, will not be there. So if I continue to use the same amount of the substance, the effect will not be the same. Number 5, there is a preoccupation. The person is preoccupied most of the time thinking about the substance or going to get the substance or how to go and get the substance, or who will he ask for somebody to bring that substance. And so he is most of the time thinking about the substance and with the planning and spending time to go and get it or ask somebody to get it for him. And this is manifested by important alternative pleasures or interests being given up. So if the person is used to do other pleasure activities and they have other pleasure interests, they will even stop these ones in order to get the substance they are addicted to, being given up or reduced because of the substance use. So the importance of getting the pleasure from any other activities is much less than the pleasure of getting to go and get the substance itself, or a great deal of time being spent in activities necessary to obtain. So a large amount of time of the person who is addicted or who is dependent on the substance, his large time will be spent in activities to obtain the substance, take or recover from the effects of the substance. Number 6. There is persistent substance use despite clear evidence of harm. Consequences. So what happens here is the person may be aware that taking this substance is affecting him with the money, affecting him with the health. Like person with alcohol problem may get stomach ulcers, may get even liver problems, despite being aware that it is causing damage to their family, relationships, friendships, and his behavior, his money, his finances, and driving and getting charged or having accidents. Despite the harm caused by alcohol or any substance being used, the person does not stop taking the substance. That was another criteria for the dependence syndrome. So number 6 is persistent substance use despite clear evidence of harmful consequences. And this is evidenced by continued use when the individual is actually aware or may be expected to aware of the nature and extent of the harm. Thanks for watching. If you have or if you know someone who have these symptoms, please get the professional advice. Substances can be dangerous and cause dependence, and it can be helped by getting the proper help. If you like this video, please press the like button, share with your friends, and subscribe the channel for more videos on mental illness. See you again.